Good morning, everyone, and good evening in India and Europe. In this session today, we are going to learn how Ayurveda can help with the healing process of acid reflux, which is very common. We have Vaidya Rajeshwari Nanaya, who is a researcher and associate professor at the Amrita School of Ayurveda. She's going to present this topic today. I am Amita from Nourish Talk, a platform for natural and holistic therapies. I would like to introduce all of you to Professor Nanaya. Welcome, Professor Nanaya.
Thank you, Amita ji. Okay, shall
So
I start?
Yes, you can get started. Absolutely.
Okay. So my topic is it is decoding acid reflux through Ayurveda. How we can easily understand and how we can manage this disease through Ayurveda. So let me give some of the introductions related to this. In that, acid reflux, we call, or a patient comes to us and tells us it has something related to the gastritis. This is a common terminology what they use. But as in a medical profession, this acid reflux is understood in a very wider sense, and all the symptoms which are related to the esophagus, stomach, and even duodenum. These three structures will be involved in its pathology, and there are some anatomical changes will happen. There are some physiological changes will happen, and there are some environmental factors, or it may be a stress factors, occupational factors. All these club together, and it goes as a one clinical symptoms from the patient side. So how we can assess this and how we can easily treat these diseases, or how effectively we can manage with the medications or even diet and home remedies is a point of discussion today. When we come to a clinical presentation of a patient, what are the points we are going to assess, and how effectively we can treat these diseases depends on in what stage the patient comes to us. That is very important when we are dealing with such diseases, because blindly or in a broader sense, I cannot say that all the reflux esophagitis or reflux acid reflux diseases can be treated by Ayurveda. This is not be true always. There are certain conditions which can be treated effectively, and the one can get relief within 7 days or within 5 days or maximum within 2 weeks. So this is a strategy what we have to understand. And when a consultant sees such a client, and we'll be having 3 points in our mind. What are those points? Whether this condition can be cured, whether this condition can be managed with the diet, or whether this condition can be in need of some advanced treatments or not, or whether we need some help from the allopathy system of medicines. So like this, these questions will be coming. So all those points we put it together as a prognosis. Okay. So whenever one person comes to us, how we deal with that diseases, and how I decide with the clinical conditions, and what is my plan, and how effectively I can treat, and what are the benefits that person can get. So these strategies I need to follow. For that, once this point is clear, how I what is the stage of the patient, then we can assess, or we should assess, what is the clinical presentations. And based on the clinical presentations, we have to interpret this whole disease in our language. We know that in Ayurveda, all the diseases are explained under three doshas. We call it as Vata, Pitta, and Kapha. And the diet modifications, the treatment methodologies, everything changes from persons to person. In total, we can call it as a customized medicines. For individually, we have to give separate advices, and also even the diet patterns. And once this point is also clear, then we need to break the pathology. How we can break the pathology? Once again, it's through the diet, or it is from the some of the remedies which we can get from our kitchen, or there is a need of a consultant. So these three steps we are going to follow. When we come to the overview of an ailment, what will be the first complaint told by the patients? So the first complaint will be something is coming, or it is like a regurgitation. We call it as a, there is a regurgitation of food contents from the stomach to the esophagus. This is the medical terminology. So whenever patient burps, there is a small part of food is coming, and he feel the sense of food coming back into the esophagus. So this is normally present in all the individuals for about 20 minutes per day, but it may not, if it exceeds more than that, then we call it as a disease. After, immediately after a heavy meal or something, if you are taking a liquid diet and all, there will be a small amount of regurgitation, no problem. So that is a normal one, but this occurs more than 20 minutes per day. So then we call it as a illness. So what will be the etiologies? So here we have to, I'm just giving you a hints regarding what are the terms a doctor says, or if you have already diagnosed with these diseases, what is the problem that will be that will be written in your reports. So the etiological factors, like they'll be telling something related to hiatus hernia. There is a big word is will be explained there. So this is something related to the anatomical changes that happens in the uh, lower part of the esophagus. It means between the stomach and esophagus, there is a gate which protects the contents of stomach from not allowing back, that is not to regurgitate back into the stomach. So this gate, when this gate is damaged, so that is the main issue in 90% of the cases due to long term illness, or the patient is having improper dietary habits, there is a regurgitation oftenly happening in them, and over a time period this becomes a illness. So that we call it as lax LES, or it is the relaxed lower esophageal sphincters, and it happens most of the times because of the improper dietary habits, and in few cases it may be related to congenital anomalies or something related to the muscular issues. All those will come, and here let us concentrate only with the dietary issues. So once it happens, next is a advanced stage, that is a hiatus hernia will happen. So this is a small portion of stomach is coming to the uh, coming towards the esophagus. This is the anatomical changes which is going to happen. Third one, when we study here, we'll be seeing this Helicobacter pylori is the one organism which is responsible for the onset of reflux esophagitis. This is most common in few European countries and also in certain parts of Asia and India. And nowadays the frequency has been diminished, but still there is a chances of infection of Helicobacter pylori. And once these three mechanisms happens, once there is a onset of all these changes happens in the stomach and the in the lower end of the esophagus, then there is a clinical features. Here the patients will tell us a simple clinical features like pain. So we need to ask, where is the pain? What exactly its pattern? When it increases, when it decreases? We need to note down all these so that we are going to get an exact picture what is the problems related to the that particular individual. Now, once the pain is asked, you need to, the immediate question you have to ask is related to site of the pain. Where is the pain? Then patient says it is just below the chest, near to the heart region, or they may say near to the stomach region, or towards left and towards the middle. These are the common terms they are going to tell. So with that, we have to decide whether it is related to the upper part of the esophagus, lower part of the esophagus, or it is related to the stomach. So this kind of approach we are able to identify with the symptoms told by the patient. Next is a dysphagia. The dysphagia means it is a difficulty in deglutition. So never think that this gastritis or acid reflux will be pertained to or restricted only to the esophagus and stomach. In few cases, the symptom starts from the throat. Because of this regurgitation, few can have pain in the stomach, pain in the throat region, or a kind of discomfort, ulcer formations and all. Even they are unable to drink the water or even swallow the food. This kind of things will happen. And third one is a hemorrhage. Hemorrhage means it's a bleeding, and few can say about the sputum mixed with the blood, or the saliva mixed with the blood, or even the frank vomiting which is mixed with the blood. So these are the most common clinical features we are going to get. And hemorrhage or bleeding will be common when there is a vomiting. Now how we can assess, how Ayurveda will understand this mechanism. So in our science, all the acid peptic diseases or acid reflux diseases, we call it as it is a problems related to the Pitta dosha. It's a problem related to the Pitta dosha. Then, Amitaji, I'm unable to see the slides.
I've already moved it, Dr. Rajeshwari. You should be able to see it.
No, I'm getting the first slide, means first picture itself.
I have moved it. It should be fine.
No,
I can see it. It's the primary dosha is Pitta and the associated dosha is Vata and Kapha. You're not able to see it?
No, that screen is missing in front of me.
Okay. I've already moved it. I can see it.
Okay. Okay, fine. Let me try with this. Okay. If it's clear for you, then I'm fine.
Okay? Yeah, it's clear. It's clear.
Okay. Then we need to say about the doshas. So these are the primary factors or functional factors which are responsible for all the illnesses which is happening in our body. And because of that, we have to treat the patient as an individual, because I cannot set a kind of similar treatments for all the patients. So that is the point I need to highlight here. The same set of treatments or same set of prescriptions cannot be given to all the persons who will be having this kind of symptoms. So here, primary dosha will be Pitta, and we have to assess which is the next one. So which is the next dosha, then it will be giving the symptoms. And based on the predominance, the second predominance and the third predominance, all our treatment is going to, our diet is going to be explained to the patients. So now, for example, I'll give you which symptom is prevalent. So few can say about bloating, and we call it as Vataja. Few can say about burning sensations, then we call it as Pittaja. Then some persons can say that there is a loss of taste, no taste in the mouth, there is excessive salivations, and that conditions we call it as a Kapha. So for all these symptoms, the treatment or prescriptions is going to change. Even diet is also going to change. The remedies, home remedies, if we are advising, that also goes on changing based on the most prevalent symptom told by the patient.
Okay, I'm moving on to the next slide. That's understanding in terms of Ayurveda.
Yes. So in the understanding of this particular diseases or any diseases as per Ayurveda, we'll come to the basic element, that is the Agni. Agni, as you know, it is a digestive fire. And why I bring up Agni here is, in the beginning, I told this disease is related to the diet. Most of the patients will be having an improper diet if you assess them retrospectively. So improper diet will lead to improper digestion, and improper digestion when happens, so it is going to cause all these illnesses, and the terminal outcome will be a malnutrition. So when we go with these descriptions of acid reflux diseases or something related to the peptic ulcer and all, the end point the person lands up with the malnutrition. So this is considered as a complication, a delayed complications, and also we can see in person all these symptoms will be prevalent in them. So when a malnutrition patient comes to us, we can take a history and we can just talk to them for a while. Then we can understand how his or her diet is there and what is the digestion capacity and all, whether it is normal or something abnormal is there, and that will be in total it is ending up with the malnutrition. So this is how this chain is connected, and this impairment in Agni is the base for all the dyspepsia. Dyspepsia means it's a common term told for the indigestion, and all the reflux becomes the victim, or it is the Agni is a culprit who is going to cause all these diseases. So this is how these doshas and Agnis becomes more important when we give a proper advice to the patient. So it is an individualistic advices. We need to concentrate, or we need to focus on that.
Okay, moving on. How do we manage it in Ayurveda now?
Yes. How do we manage in Ayurveda? So we have to keep in two aspects. That is, one is with the diet, another with the medicines. So in initial stages, if patient comes to us, or if they are asking with the 1 or 2 episodes of such an experiences, then we can ask their diet and we can modify their diets. And if it is more than 6 months, if the chronicity of this illness is more than 6 months, then they need a medical attentions. Otherwise, the problem may not be solved with the remedies or even with the dietary managements. Of course, it's required, it should go hand in hand with the medicines. So we'll come to the first part of interventions, how we can treat these diseases or how we can manage it effectively by knowing how they are showing us few of the symptoms. As I told earlier, there is some discomfort starts from the throat itself. So in such cases, we have two herbs which are very effective here. If a person is having a difficulty in swallowing, there is some burning sensation, there is some difficulty or ulcerations, we can small boils, such appearances can happen in the throat or even in the mouth ulcers. Also, we can suggest these two combinations. That is, it is a decoction we need to prepare with licorice. This is commonly we can get in the herbal shops, and also Triphala. This Triphala, if it is given to give a wound healing property, if there is some ulcerations and all, if there is a burning sensation, if you need to give some soothing effect to the mouth or even to the throat or to the chest region, then you need to select the Estimadu, or it is called as licorice. And if I assess Triphala is having something painkiller properties also there, Vatahara and Kaphahara, whereas Estimadu is mainly Pittahara. So based on the symptoms, we can select these two herbs. Next is this is just an idea I am giving. What are the herbs which can be used in our diet or which can be taken along with our normal foods, or we can process our food with these ingredients and all. So if you are suffering, if a person is suffering from acid peptic illness or reflux esophagitis, then better to take it's not, I have written a cold water here, But compared to the, or if we are from the cold countries and all, then we are unable to take a normal temperature water. Let it be a warm water, should not be a very hot water, which can be mixed with the honey, and they can drink it. It heals the, if any ulcerations has happened throughout the GIT, then it helps to heal that, and also it protects the layers of our mucosal layers, we call it as mucosal layers of even the esophagus and the stomach regions. So we'll get a soothing effect. And if you are opting for some fruits, this is a pomegranate is the best for such diseases. And all these herbs or the all the diet I'm mentioning, not from the any other text and all. It's from what is written in Ayurveda. I have selected few of the commonly available herbs and also dietary supplements that can be included in our day-to-day life. So pomegranate is such a fruit which can be used in plenty, and you never get any of the adverse symptoms because of intake of this pomegranate. Another one is gooseberry. Even this is also, even though it is sour in taste, when it is digested, it becomes sweet. So this is a wonderful drug, which or a wonderful herb, and also it's daily you can utilize in our diet. And it is a green gram. A green gram means it is lentil, which can be used in plenty. It will not cause any bloating of abdomen. It will be relieving constipation, very light to digest, very easy to digest. You can use it as a soup, or you can mix it and you can take it as a gruel, or you can even prepare a khichdi out of it. So these are the modifications we can make. And if you are available with the coriander seeds, that is also very good. Cold infusions means you can just put the coriander seeds in one glass of water, normal temperature water, and keep it overnight. Next day morning, on empty stomach, you can have this coriander seed water. It is highly beneficial. It relieves all the burning sensation which happens early in the morning, and if there is a sensation of regurgitation, that also clears. Among the oils and other ghees, butter will be very good to infuse in your diet, and you can cook food or you can mix the butter in your breakfast or even the lunch and dinner. And I suggest this licorice, which can be included as a dietary supplement or as a diet, and also it acts as a medicine. This licorice should be processed with milk. It's a small amount, 1 or 2 grams of licorice powder can be mixed with a small glass of water, nearly 30 to 40 ml. Bring to a boil, let it cool to the normal temperature, then you can have it. Don't take it hot when it is hot. And if you practice this licorice milk every morning on empty stomach before taking tea or coffee, anything, then this is going to heal the ulcers. If you have a gastric ulcer or a duodenal ulcer or some burning, severe burning sensation is there, vomiting is there, if they are unable to have any food, then just have a licorice milk, then it is going to clear the symptoms in a week. Next, I just come to what is the Ayurveda understanding here. Why we'll be suggesting a medicine which is infused or which is processed with the ghee or milk. Usually when you saw in the previous slide, you could see that I'm telling licorice milk has to be utilized or it has to be processed with milk, and then you can consume it. But the Western science says that it is not, milk and milk products should be avoided. But when we process this licorice with the milk, it will not give any adverse effects. This is for sure. If you are lactose intolerant, then you can skip it off. Otherwise, you can take the milk processed with the licorice powder. Now, in one pathology I need to explain here, because the next combinations what I'm going to advise is from the ghee. So ghee is a such a medicine. It is having such a medicinal properties, and also it is highly rich with the antioxidants, which is going to protect the mucosal barrier. So when our stomach is covered or lined by one mucosal layers, and because of this acid secretions, this mucosal layer is going to destroyed, and that is the reason why all the ulcer conditions are happening. So this ghee will give like a protection, and when it is processed with medicines, that medicines can act in that particular area, and ghee acts as a protector. Hence, if you are having a habit of taking a 1 or 2 teaspoon of ghee, provided you don't have any other illnesses, then it is highly advisable to avoid such acid peptic diseases. Now, this is a point which I was explaining. It always our food should be included with the ghee or butter. Butter is advisable to some extent. If ghee is available, then that is the best. And butter gives a cooling effect, and ghee is a healer for all the ulcerative conditions. If ulcer has been already set in a patient, so it's better to give a ghee. There are preparations which are basically given for the ulcer patients, and all will be of a ghee. We have a dadi madhyagrita, that pomegranate is processed in a ghee, and it is given to the patients, and that is going to give all the that is going to give the soothing effect to all over the gastrointestinal tracts. So this is a principle which I wanted to just share. So these are the some treated cases. I'm just have put some of the points here. You can see before treatment and after treatment I had given. I had told lax ileus in the beginning. So whenever there is a lax lower esophageal sphincters, I had told it is an anatomical defect, but the symptoms can be reduced. This laxity cannot be corrected by our medicines. So when you see the second report, the lax ileus remained the same, and mild antral gastritis, that is, antral gastritis means the antrum stomach is having a part. In that antrum part, there is a ulcer. So that is a impression which is given here. And in the second part, it is changed from the severity has come down to the mild. So it says that the anatomical changes cannot be corrected, but we can change, we can bring down the severity of the clinical symptoms. So some terminologies, once again, I had explained, like a GERD and hiatus hernia. See, they are often lies together. They'll be they'll be giving the symptoms in combinations. And I have told that gastric erosions means there is ulcerations will be formed. So these erosions are nothing but the trauma which has happened because of excessive acid secretions. So that can be treated with by giving a milk processed with the licorice and also the ghee. That's the reason why we need to protect the mucosa of the stomach. This is a for and even the treatment will be similar to duodenal ulcer also. See, we can get all the terms here. Esophagitis of the lower end, and hiatus hernia is present, gastritis is present, bile is refluxing into the stomach. It is a duodenitis. The problem is there from the duodenum, but all the structures above to that is suffering because of the regurgitation. Even from the esophagus, it can enter up to the upper part, and that's the reason why they will get a throat irritations or the throat pain or difficulty in swallowing the food. So one more, this is a rare case I just wanted to share with you. It's a prolapsing gastropathy. So if a person is suffering from excessive vomiting or retching is there for unknown cause or because of the food poisoning and cases and all, then over vomiting can cause this kind of presentation. So this is not a chronic one. This will happening in a very short span of time, And once that illness goes off, it will come back to the normal. This doesn't require much of the interventions by the clinicians. So that was my brief explanations regarding this particular topic. I welcome the questions. I'm very pleased to answer those.
Yeah, thank you so much. That was, I think, very well explained. We are open for questions. Please put them in the chat window, and I will go through it. Okay, so someone is asking, what are the potential causes for burping on and off for hours after meals? Why does this happen instead of just flatulence occurring?
Okay. So burping is happening because of a few more conditions I need to include here. It may be, I told in the beginning, improper digestion can happen with a bloating abdomen, or few food items like a potato or a starch-rich foods or something protein-rich, it is cotyledons if you are taking. Such foods also can induce the bloating. And one important point which is mimicking like that of a acid reflux is illness related to the liver. Whenever the person is having improper digestion at the level of liver, even though we know that if even whatever food we consume, that is completely transferred and it is stored in the liver. Even if the liver is not functioning properly, like common illnesses such as fatty liver, or if a person is not having food on time, he is leaving the stomach empty for a longer time. So such are the issues which are going to cause this burping and all. And I say it is most of the times it will be because of the food that we consume, and it is going to cause a improper digestion and accumulation of gas in the stomach. And another one is issues related with the liver. So kindly check whether you have something related to fatty liver or not. And this is a common clinical presentations with the fatty liver. And if it is so, if you are taking some liver tonics or if you are correcting that illness, the problem is automatically goes off.
Okay, so please put your questions in the chat. We are going to do that. Okay, so someone is asking, bottled kasayams contain preservatives. Does it precipitate the symptoms? So
Bottle?
I think from what I'm understanding is someone is saying that if you buy the bottled kasayams, from the from the pharmacy, or you just go and they probably put some preservatives so that it doesn't bad.
It's obvious. And one more point we had to stick on is like if you are having acid reflux, better to avoid kashayam in the beginning. It is going to worsen the conditions, and that, as I explained earlier, the mucosal layer of stomach is already damaged, and kashayam is quite dry. It is called, we call it as it is predominant of vata, like that. And it is going to cause a kind of irritations to the patients, and that's why it's better to avoid. And even the preservatives is also going to give some of the ill effects over the abdomen. But I say, I mean, most of the cases we are avoiding kashayams, except it is a kaphaja case. As I explained, whenever there is an indigestion, like symptoms are there, then only we are going to suggest. But if it is a bloating, if it is in the burning sensations, in 99% of cases, you need to avoid the kashayam.
Okay. So someone is asking, can we opt for Yashti Madhu, Kashir Phaka, for a chronic diabetic patient who is on insulin for such gastric complaints?
Okay. So usually when you see the clinical trials related to the licorice, it is 10 times or 15 times more sweeter than the sugar. Okay. But if you are diabetic, but if your condition is not responding to any of the antacids or medicines, then if burning sensation is there, then you can take for 7 days, for a maximum period of 7 days. and at most you can take up to 10 days, not more than that. That may shoot up the sugar levels. Yes.
Okay. Someone is asking, by the way, we are going to do group workshops, and
Yeah.
these are just informational and educational session. I just want everyone to understand.
Okay.
But Dr. Rajeshwari is happy to answer your questions.
Okay.
So someone is asking, I have been diagnosed with GERD and have been taking omeprazole 20 milligrams a day in the morning for the last 20 years.
Okay.
Wow. When I forget a dose, I get heartburn within 24 hours. Do you suggest any particular trial, for example, licorice with milk?
Yes, you can absolutely, you can take, no doubts. Licorice milk powder, if you are getting, then take it maximum 3 grams per day. That should be the dose. Otherwise, you are going to get a nausea or kind of vomiting sensations will be there. So better to take a smaller dose in the beginning, like 2 grams or 3 grams, and boil with 50 ml of water and 50 ml of milk. This should be the ratio. 3 grams of powder plus 50 ml of water plus 50 ml of milk. Boil for 5 to 10 minutes until it becomes a 50 ml. Means reduced to 1 glass. Then you can have it on empty stomach early in the morning. And after having this licorice milk, you should not have any food for about 20 to 30 minutes or even 45 minutes. That will be doing best. After 45 minutes, you better to have a breakfast or something. So you have to keep your stomach empty till 45 minutes after intake of licorice milk. You follow this for a week, you can observe some changes. And meantime, if it is not responding, better to go for a endoscopy. Is there any other changes have already happened because of 20 years of long chronicity? And that may be the reasons. Sometimes it may not work for you. So that will be an absolute approach that you can follow.
Okay, I've written an email here in the chat window, care@nourishtalk.com. If you want to consult with Dr. Rajeshwari or any other questions you have, you're welcome to email us. Okay, so we have another question. Someone is asking, is any kind of kasara, alkali preparations, effective in acid peptic diseases?
Yeah, we'll be giving a kshara preparations we'll be giving, but that cannot be taken for a longer time. Even a small pinch of medicines will be given. So that needs a consultant's supervision. And it is like either we can mix with some of other medicines and we can give to the patients. It is alone, it will not be advised in most of the cases. And better to take it for a short time period, because it just acts as a neutralizer. Acid is there, when you give alkali, it is going to neutralize it. So long-term usage is not advised.
Okay. Someone is asking, is it a good or a bad idea for someone to take digestive bitters and ginger tea before every meal? Or could this damage the lining of the stomach or intestine over time?
Yeah, if it is medicine should be taken in a very particular dosage. When you consume the same type of food or same kind of medicine for a longer time, it can show some adverse effects also. So ginger will be good when you are having a food which is heavy to digest. Ginger tea can be taken when you are having a heavy meal. But if you are on an empty stomach and if you are having a small snack, and before that, if you have a ginger tea, it can increase the digestive fire. But at the time, you may not be having much of the contents in the stomach. Rather, it damages the stomach lining than digesting the food or helping in the digestion. So this should be adjusted according to the type of meal which you are going to prefer.
Sure. All right. Any other questions? We are going to wrap up in a couple of minutes. So let us know any other questions you have. This is I think a doctor is asking about the role of purgation therapy. Maybe you can talk for 30 seconds. These webinars are intended for the end users and the clients, not doctor to doctor. So, but if you want to say something for 30 seconds on purgation therapy.
Purgation therapy is not that much advisable in the initial conditions and all. If it is because of some other illness, like I told about liver illnesses and all. So if it is secondary to some other diseases, then we can go for that.
Sure, sure. Okay. Someone is asking, what about the digestive bitters like dandelion root, genesian root, or any other similar ones? Those digestive bitters. Can you take them? Or I think.
Yeah, it is, I told no, just like a herbal tea, that is ginger tea.
Yeah.
It should not be illogically administered. That is the thing. And because each individual's capacity is different, it is not something that we are going to supplement to universally. It is every individual is having a different temperament, and we need to decide accordingly. So it may be suitable for few, it may not be suitable for the few.
Yeah. Someone's asking, are you aware of any long-term side effects of taking omeprazole for a long time, like 20 years? Someone's been taking medication for 20 years. I think.
But omeprazole or any antacids, as far I know, they are going to decrease the digestive capacities, and over a time they are going to suppress the complete process of digestion, because they are directly acting on the cells which are going to secrete these acids. So we are blocking their functions. Over a long time, if you are blocking the functions, it may become lazy and it cannot perform any of the activities. So that is a complication is available. It's already explained in almost all the researches, and we find it practically too.
Sure, sure. So I think someone's asking how much gram of Yashti Madhu can be taken for Kashira Paka preparation. You mentioned that earlier.
Yeah, I told it. Maximum 3 grams, not more than that.
Yeah, she talked about it just a few minutes back, 3 grams on Yashti Madhu. Okay, I think this is a very engaging topic and very engaging audience. So you know, it's great. We are going to have group workshops, you know, where you can ask very detailed questions from Dr. Rajeshwari in October. I highly suggest, please let us know if you are interested. We will let all of you know. These are just informational sessions, and unfortunately, I have to wrap up right now. So any final question before we wrap up? Okay. All right. How much? Okay. So we talked about that. What medicine to take for peptic ulcer with stress, whether to treat stress or treat peptic ulcer? That's the question.
First priority is given to stress. You have to manage the stress. Second priority is for the ulcers. It should go both hand in hand, but priority wise, we have to treat the stress first. Yeah.
I think all of us are stressed out nowadays. So
yeah.
All right, with that, I would like to thank all of you for joining our session. I have written our email. If you have more questions, please feel free to email us. We will pass it on to Dr. Rajeshwari. If you have any other details, consultations, please email us again. Dr. Rajeshwari, you want to say something, final comments before I wrap up?
And I am very thankful to you. It was a nice interactions. And I don't know how far I could simplify the sessions, because for the common audience, I was unable to reach my points. Hope it has reached. The question says that it has reached the audience, so I'm happy for that, and I'm extremely thankful to you.
No, absolutely. Thank you so much. I think you presented it in a very simple way, which I could understand as well. So you can, and I hope people who have been joining us, please give us the feedback for the sessions, because she's a professor and she did her best to give us the very simple way. With that, thank you so much for joining us. Please share our sessions, help us spread the word. With that, thank you so much for joining. Signing off now. Have a great evening. Bye-bye.
Bye-bye. Thank you.